Usually, when we talk about a medical diagnosis, there's this expectation of precision, like engineering.
Right. It's supposed to be binary.
Exactly. You break your arm, the X-ray shows that jagged white line, and the doctor just points and says, there it is.
It's visible, it's categorized, and honestly, that's comforting.
It is. But then you step into the world of aesthetic and functional gynecology, and suddenly that X-ray machine is just useless. We are looking at a diagnostic landscape that is entirely murky.
Very murky. The whole field is transformed.
Yeah, and today we are wading right into those muddy waters. For this deep dive, we're looking at the rapidly evolving and sometimes pretty controversial world of intimate health.
Which is such an important topic for so many people who just suffer in silence.
Oh, absolutely. I mean, we are moving far beyond the basic Kegels and standard advice of the past. We're looking at how cutting-edge technology and injectables are revolutionizing bladder control, tissue function, and sexual wellness for you, the listener.
The lines between aesthetics, physical function, and sexual wellness have blurred in ways we've really never seen before.
Right. And we've got a massive stack of sources for this today. We're pulling from clinical guidelines, breakdowns from medical spas, and even some really advanced plastic surgery texts.
It's a lot of material to synthesize.
It really is. But our mission today is to demystify two major modern treatments: the high-tech Emcella chair and the G-shot injection.
Two very different but very popular approaches.
Yeah, we're going to separate the scientific reality from the marketing hype and help you understand the mechanics, the risks, and the really fascinating anatomical debates behind them.
Because, when you're dealing with procedures that affect your daily quality of life, understanding the why and the how behind the medicine, that's non-negotiable.
Totally. So let's just jump in. How do we get from standard physical therapy to, high-tech electromagnetic chairs and intimate dermal fillers? I mean, it feels like we leaped a century in a decade.
It really does feel that way. But what's interesting is that while the tools have evolved to become radically more efficient, the core objective actually hasn't changed at all.
Oh, really?
Yeah. Whether we're talking about traditional physical therapy or a magnetic chair, the goal is restoring neuromuscular control and enhancing tissue function.
Okay, so the destination is the same, we're just taking a faster car.
Exactly. We are still trying to solve the exact same foundational issues.
Yeah.
Weakness, laxity, and the loss of sensation that occur due to, childbirth, aging, or hormonal shifts like menopause.
Right, which happen to so many people. So starting with that foundation, to understand any of this, we have to talk about the pelvic floor, which is essentially like a hammock of muscle, right?
That's the perfect way to visualize it. It is
Yeah.
a dense, muscular hammock sitting right at the base of the pelvis.
And it has a pretty big job.
A monumental job. It has the constant task of supporting the bladder, the uterus, and the bowel against gravity every single minute of the day.
So when that hammock starts to fray or, lose its tension, everything sitting inside it naturally starts to sag.
Yes, and that leads to massive quality of life issues. We're talking about stress urinary incontinence,
Yeah.
which is when you leak a little bit, when you cough, laugh, or exercise.
Which is incredibly common, but nobody talks about it.
Exactly. It also causes urge incontinence, chronic pelvic heaviness, and a really severe decrease in sexual sensation. And for decades, the standard medical answer was simply, just do your Kegel exercises.
Right, which most people either forget to do or they aren't entirely sure they're even isolating the correct muscles in the first place.
It's actually very difficult to do a proper Kegel if the neuromuscular connection is already weakened.
Which brings us to our first major technology. Enter the Emcella chair. This is what we're calling the macro approach because it targets the entire pelvic floor muscle group at once, right?
Correct. It treats the whole hammock.
So what is the underlying technology here? How does a chair do this?
The Emcella chair utilizes HIFEM technology. That stands for high-intensity focused electromagnetic energy.
Okay, electromagnetic energy. According to the manufacturer guidelines in our sources, the patient experience sounds almost suspiciously easy.
It does sound a bit like science fiction.
Right. You go into a clinic, you stay fully clothed, and you just sit on this specialized chair for, 28 to 30 minutes?
That's it. You can literally sit there and read a magazine. And while you sit there, the device generates and delivers these intense electromagnetic pulses.
And they just go right through your clothes?
Right through. They penetrate about 10 centimeters deep directly into the pelvic floor. And these pulses trigger what the medical literature calls supramaximal contractions.
Okay, let me stop you right there, because the numbers in these sources are they're wild.
They're very high.
The claim is that a single 28-minute session is the equivalent of doing roughly 11,000, or depending on the source, 11,200 Kegel exercises.
Yes, 11,000 contractions in half an hour.
Hold on. 11,000. Is this just a lazy way out for people who don't want to do their exercises? Or does it actually do something voluntary exercise can't? Because that sounds like a pure marketing gimmick. How can a human muscle physically contract that many times without tearing or just completely failing?
I get that a lot. What's fascinating here is the biology of a supramaximal contraction and really understanding how our own brains limit us.
Our brains limit us.
Yeah. The prefix supra means above or beyond. These contractions literally exceed the maximum intensity and frequency that you could ever achieve through voluntary effort, even if you were a professional athlete with perfect form and focus.
Okay, but why? Because our brains just won't let us push the muscle that hard?
Exactly. When you do a voluntary Kegel, your central nervous system naturally governs how many muscle fibers it recruits at one time. It does this to prevent injury and exhaustion.
So it's holding back on purpose.
Always. You might only be recruiting a very small fraction of that muscular hammock when you try to flex it yourself. HIFEM technology bypasses the brain's governor entirely.
Oh, wow. So it's like hot wiring a car instead of turning the key. Like the brain is the key, but the magnetic field reaches under the dashboard and just directly sparks the engine, the muscle itself.
That is a brilliant analogy, yes.
Huh?
The magnetic field directly depolarizes the motor neurons.
Depolarizes.
Yeah, in neuroscience, depolarization is the electrical shift that forces a nerve to fire. So the HIFEM energy reaches into the tissue and forces those neurons to depolarize, which causes 100% of the pelvic floor muscle fibers to contract simultaneously.
100%. Wow. So it's firing every single fiber at once, thousands of times in half an hour.
Exactly.
But how does the tissue respond to that level of artificial trauma? Doesn't it get damaged?
Well, skeletal muscle responds to extreme load by adapting. By subjecting the pelvic floor to this impossible-to-achieve voluntarily workload, you force rapid muscle fiber remodeling.
Okay, so it gets stronger.
Much stronger. The muscle fibers thicken, the blood flow to the entire area increases dramatically, and crucially, it restores the synaptic pathways between the brain and the muscle, which is that neuromuscular control we talked about at the beginning.
It reestablishes the connection. Because it forces such a profound physiological adaptation, the benefits listed in our clinical sources are pretty sweeping.
They're very impressive across the board.
Yeah. For women dealing with incontinence, 95% report a significantly improved quality of life, and there's a 75% reduction in pad usage, which is huge for someone's daily comfort.
It's life-changing. And the benefits extend to men as well, actually.
Wait, really? Men use this too?
Absolutely.
Yeah.
The sources explicitly note that Emcella is highly effective for treating male erectile dysfunction.
Oh, because it strengthens the muscles at the base of the pelvis.
Right. Those muscles are crucial for maintaining the blood flow required for an erection.
Yeah.
So strengthening the hammock benefits male anatomy just as much.
That makes total sense. So what's the timeline for this? Do you just go once?
No, the standard protocol to achieve these actual structural changes is a series of 6 sessions, usually done twice a week.
Okay, so a 3-week boot camp.
Exactly. Followed by maintenance sessions every 6 to 12 months, depending on the patient's baseline strength.
All right, but with all this intense magnetic power penetrating the body, there has to be a catch. The exact mechanism that makes it work, the electromagnetic field, must create some serious safety limitations.
Oh, absolutely. The contraindications are very strict.
Like what?
Emcella cannot be used by pregnant women, anyone with a cardiac pacemaker, implanted defibrillators, or people with metal implants in the pelvic or lower lumbar region.
Which brings up a very practical question for you listening right now. If this energy penetrates 10 centimeters deep right into the pelvis, what happens if someone has an IUD?
It's a great question, and the sources make a critical distinction here. A copper IUD is an absolute contraindication. You cannot use the chair.
Because it's metal, and magnets interact with metal. But what is the actual physical risk? Does it rip it out?
No, it's not a pulling force. It's a process called induction heating.
Induction heating. Like a stovetop.
Exactly like that. The intense, fluctuating electromagnetic field generates electrical currents within the copper itself. The copper naturally resists those currents, and that resistance creates heat.
Oh, wow. So you would essentially be microwaving a piece of metal inside the uterus.
You would. It poses a severe risk of internal thermal burns. It's incredibly dangerous.
But not all IUDs are copper, right?
Right, which is the other half of the distinction. If a patient has a purely plastic hormonal IUD, like a Mirena, The treatment is generally considered safe. Plastic does not conduct those induced currents, so there's no heat generated.
That really highlights why this must be treated as a serious medical procedure and not just, a casual add-on at a day spa.
Exactly. Improper screening can be catastrophic.
A provider really has to rule out things like recent hip replacements, surgical screws, or even like an active malignancy in the pelvic area, right? Because increasing blood flow to a tumor is obviously a terrible idea.
It requires a very thorough medical history before anyone sits on that chair. It is medicine, not a spa treatment.
Okay, so Emsella rebuilds the muscular scaffolding. It fixes the structural foundation. But a strong hammock doesn't necessarily equal heightened sensory pleasure.
No, it doesn't.
So if the foundational muscles are fixed, but a patient still struggles with physical sensation, where does modern gynecology go next?
This is where the literature transitions from that macro approach to the micro approach.
Or micro approach.
Yeah. If Emsella focuses on overall muscle strength and function, treatments like the G-shot focus entirely on localized sensation and anatomical manipulation.
Okay, so let's unpack this. What exactly is the G-shot, mechanically speaking?
The G-shot or G-spot amplification involves injecting a biocompatible hyaluronic acid filler into the anterior vaginal wall.
The anterior wall. So spatially, where are we talking about?
It's about 3 to 4 centimeters inside the vaginal canal, situated on the upper wall near the urethra.
And hyaluronic acid, this is the exact same type of dermal filler used in facial aesthetics, right? Like the stuff people use for plumping lips or contouring cheeks.
The very same material, yes.
So the goal here is to literally add physical volume to that spot.
Exactly. The filler makes the tissue in that specific, highly innervated area more prominent, thicker, and essentially easier to locate and stimulate during sexual activity.
Wow. So what does this actually look like for the patient? Is this a major surgery requiring general anesthesia and weeks of recovery?
Not at all. It's a quick outpatient procedure. It takes maybe 20 to 30 minutes total.
Oh, wow.
Yeah, and the actual injection part takes less than 10 seconds. It's performed just under local anesthesia.
And because it's hyaluronic acid, I assume it's not permanent.
Right. The body naturally breaks it down and absorbs it safely over time. The results are temporary, usually lasting somewhere between 3 and 6 months.
I did notice an unexpected functional bonus mentioned in the literature, too.
The urinary support.
Yeah. Adding that physical bulk under the urethra can sometimes actually help support the urinary tract, which can reduce mild stress urinary incontinence.
It's true. It acts almost like a subtle internal cushion. It provides a sort of backstop support for the urethra when abdominal pressure increases, like when you cough or jump.
That's fascinating. But okay, here's where it gets really interesting. We are basically talking about lip filler, but for intimate areas. So let me play devil's advocate for a second.
Go for it.
If we are just injecting a structural volume booster into the tissue, does this actually fix a low sex drive? I mean, can a syringe of gel cure a complex intimacy issue?
That is the single most common misconception, and it's a boundary that is heavily emphasized across all the medical literature.
So, no.
Definitely no. The G-shot is purely mechanical. It does absolutely nothing to treat low libido, lack of desire, or psychogenic sexual dysfunction.
Psychogenic meaning things like performance anxiety, stress, relationship issues.
Exactly. If the issue is psychological or hormonal, filler will not help. It only enhances physical friction and sensation for someone whose natural anatomy might just make that specific nerve center hard to reach.
So it's changing the hardware, but it doesn't touch the software.
That's exactly it. If the hardware isn't the origin of the problem, modifying the hardware won't fix the software.
The sources also make a really strong point to distinguish the G-shot from the O-shot, which I think people confuse a lot.
They do confuse them, but they're totally different mechanisms.
Oh, so.
Well, the G-shot uses a synthetic filler to create sheer volume. The O-shot, on the other hand, uses autologous PRP.
Which is platelet-rich plasma spun from the patient's own blood, right?
Yes. They inject that PRP to encourage long-term tissue regeneration and nerve sensitivity. So it's volume with the G-shot versus cellular regeneration with the O-shot.
Okay, that makes sense. So we know the mechanics of the G-shot, but the medical community is currently locked in this fierce, fascinating debate about where exactly this filler should go.
It is a massive debate.
And it really pulls back the curtain on how uncharted this frontier of medicine still is. What are the baseline risks of the G-shot before we get into the debate?
The general risks are what you might expect from any localized injection. Temporary tenderness, some swelling, or maybe some urinary retention if the filler is accidentally placed too close to the urethra and compresses it.
But the more complex risk involves the actual anatomical target.
Right. Because the scientific community cannot universally agree on the exact structural boundaries of the G-spot.
Which sounds crazy in modern medicine. Like, how do we not have a map of this yet?
Yeah, it does sound crazy. But advanced anatomical studies suggest that the engorged tissues responsible for this sensation, what they call the clitoretrovaginal complex, actually lie closer to the urethra than they do to the vaginal wall.
Okay, wait, let me stop you. The clitororetrovaginal complex. Break that down for us spatially. What are we looking at?
It refers to the physical convergence of the internal clitoral roots, the urethra, and the vaginal wall. It's a highly innervated, three-dimensional network of tissue. It is not just a single magic button on a flat wall.
Right, and the debate centers on where this complex is actually anchored.
Yes, because the standard, widely taught practice for a G-shot is what we call subvaginal filling.
Meaning injecting transvaginally.
Exactly.
Yeah.
Right under the vaginal mucosa, which is the skin lining the inside of the vagina.
Wait, so the standard practice is essentially injecting into the ceiling of the vaginal canal, hoping to push those sensitive structures down so they are easier to hit.
That's the intention, yes.
Yeah.
But if those sensitive structures actually live higher up, anchored closer to the urethra,
Then injecting from the vaginal side might be fundamentally flawed.
it might be. Because it might not actually push the sensitive tissue outward. It might just create a thick buffer of gel between the tissue and the source of stimulation.
Oh, wow. So standard practice might literally be injecting from the wrong side of the wall.
According to several advanced plastic surgery texts we reviewed, yes. These texts advocate for a totally different approach called transurethral augmentation.
Transurethral, so going through the urethra itself.
Yes, using a cystoscope to inject a heavier filler, like macroplastique, directly under the muscularis of the urethra.
Wait, we're talking about the actual muscle wall of the urethra here, Ralph.
We are, the dense tissue layer that actively contracts. By injecting the filler on the urethral side, the floor of the urethra basically, the filler acts as a wedge. It actively pushes the entire clitoretrovaginal complex down toward the vaginal lumen, making it vastly easier to stimulate.
That is a massive paradigm shift. I mean, if you are listening to this and considering the procedure today, how do you even navigate this safely when the doctors themselves are arguing out which side of the wall to inject?
If we connect this to the bigger picture, this anatomical debate perfectly illustrates the Wild West nature of off-label aesthetic procedures.
Because using these facial fillers in the vaginal or urethral wall is technically off-label, right?
Exactly. The FDA approved hyaluronic acid fillers for the face, not the pelvis. Now, using medications off-label is a completely standard legal practice in medicine, but it means there isn't a universally mandated, federally standardized protocol for this specific application.
Which means the skill of the injector is literally everything.
It is everything. Relying on a highly qualified, board-certified specialist who intimately understands pelvic anatomy is absolutely critical.
Because a bad injection could be really bad.
A bad injection by an underqualified provider operating without standardized guidelines can lead to rare but devastating complications. We are talking about fistula formation, which is an abnormal hole connecting the urethra to the vagina, or severe permanent nerve disruption.
That is terrifying. And speaking of complications, there is a very specific scenario detailed in our sources that brings everything we've talked about today together.
The displacement risk.
Yes. What happens if you combine the macro and the micro approaches? Let's say someone gets a G-shot, a fresh pocket of hyaluronic acid gel carefully placed to enhance volume, and then, maybe a week later, they decide to go sit on the Emsella chair to rebuild their pelvic floor with 11,000 violent supramaximal muscle contractions. How does that chair impact the risk of filler displacement?
It creates a perfect storm for severe complications. This scenario is a prime example of why comprehensive sequential medical screening is so necessary.
Right, because if you look at the strict contraindications for Emsella, they specifically warn against treatment after recent surgical or injectable procedures in the pelvic region.
Exactly, because the intense muscle contractions can severely disrupt the healing process. A fresh G-shot is essentially a wound that is trying to integrate a foreign substance into the surrounding tissue.
And one of the inherent risks of any dermal filler anywhere in the body is migration, right?
Yes, migration is always a risk. The gel moving away from the injection site before it can properly settle and integrate.
So if you subject a freshly placed pocket of gel to 11,000 hyper-intense muscle spasms,
You are introducing massive, unnatural mechanical force directly to that localized area. The supramaximal contractions induced by the HIFEM technology generate immense physical pressure within the pelvic floor,
So it's squeezing it.
violently. That pressure could very easily compress, flatten, or completely displace the freshly injected hyaluronic acid.
You could literally squeeze the G-shot right out of the target zone.
You could dramatically increase the risk of filler displacement. The mechanical force could push the gel laterally, which would form an uncomfortable, palpable lump in the entirely wrong place.
Ouch.
Or even worse, it could push the filler upward against the urethra, compressing the urinary tract and causing acute urinary retention, meaning you literally wouldn't be able to pee.
You would essentially be weaponizing your own muscle contractions against the filler.
Which is exactly why you absolutely cannot treat these procedures like a la carte menu items at a spa. You can't just pop in for a shot on Tuesday and a magnetic chair session on Thursday.
Timing is everything.
A specialist needs to sequence these treatments with extreme care. Usually this means completing the MCELA muscle rehabilitation entirely, waiting for the tissue to stabilize, and only then considering structural filler, or spacing them out by several months so the filler is fully integrated before you do the chair.
Wow. So what does this all mean for you, the listener? We've unpacked a ton of complex medical science today, whether it's using intense magnetic fields to hotwire a weakened pelvic floor from the inside out, or using hyaluronic acid to mechanically enhance intimate anatomy. Modern science is offering us incredible non-surgical tools.
Truly incredible tools.
But as we've seen, the presence of new technology doesn't negate the need for rigorous medical screening and intimate understanding of anatomy and realistic expectations about what these tools can actually fix.
The most vital takeaway from all of these sources is that while these technologies are undeniably powerful, they are not magic bullets.
Right. Hardware versus software.
Exactly. True intimate wellness demands an integrated approach. You have to respect the physical anatomy, the psychological factors, and the patient's overall structural health. You just cannot throw a magnetic field and some dermal filler at a complex problem and expect a holistic cure.
Which leaves us with a final, slightly provocative thought for you to ponder. As treatments like the MCELA chair and the G-shot become as quick and commonplace as getting a facial or Botox on your lunch break, how is this going to change our relationship with aging and intimacy?
That is the big question.
Will we start viewing functional decline and natural anatomical variations as entirely optional? Or does chasing physical perfection in our most intimate, vulnerable areas just create an entirely new set of psychological pressures for us to live up to?
It's the double-edged sword of modern aesthetic medicine. Sometimes, fixing the body just ends up complicating the mind.
It really does. Thank you so much for joining us on this deep dive. Keep questioning, keep learning, and absolutely consult your own medical professionals when exploring any of these options. And remember, sometimes the medical landscape isn't a clean, precise X-ray. Sometimes it's about learning how to navigate the murky waters. We'll catch you on the next one.